Clinical Solutions, bringing decisions to life.
Clinical Solutions' vision is to change the way people access healthcare and social services. How we do that is really through innovation and creation in everything that we do. If you look at our product set, then we've created products that have no glass ceiling. We can deploy them into any healthcare setting. If you take our clinical content, we've evolved that so that it can be deployed in a telephony setting, in a face-to-face setting, and an acute setting. Our offering to the healthcare market, and for that matter to citizens really, is to provide universal access to healthcare services and ultimately perhaps social services as well.
Clinical Solutions has a long and varied history. It was originally formed as a joint venture to service the NHS Direct contract, and that spawned a number of other contracts from that point. I think there's a number of challenges facing the healthcare community at the moment around the patient experience and journey, around best use of clinical resources and the best technology solutions to underpin that, and how they're deployed and implemented. And technology is really around the application support that they give to the clinicians at the front end that turns into the service and the experience that the patient sees.
So I think we're moving towards a position where, whether it's primary care, whether it's secondary care, or whether increasingly you're being treated in your home, there's a flow of information and an integration of information around that so that people can get the best care that's available to them from informed clinicians.
Clinical Solutions has a number of application and infrastructure tool sets that are targeted at helping the nurse community primarily, but also some of the supporting functions. It's a fact that people are living longer, that their requirements from the healthcare service are growing annually. This places pressure on healthcare deliverers, it places pressure on their resources, on their available cash. It also provides opportunities for more focused usage of those resources and that cash to get better returns both for the patient and for the healthcare setting.
We've produced a universal framework to develop applications from. Historically, we've used that product and its content in a telephone triage environment, but in actual fact, the framework is healthcare setting and sector independent, and on that basis, we've created products for walk-in centres and the independent treatment sector that utilise our clinical content to triage patients so that they treat appropriate patients, and patients that should perhaps go to an A&E department to send to that location. We've also created things like biosurveillance, again out of the same framework, utilises our clinical content and algorithm technology and enables our customers to create algorithms and protocols for avian flu, for SARS, and for virtually any other biological incidents that may occur. We've also created products for the out-of-hours sector, which again, using our face-to-face scripts, where through natural language a clinician can consult with a patient, and we can create the documentation that sits off the back of that, which effectively documents the whole encounter. We're going to use that technology in our walk-in centre space, and we're looking to promote our framework into general practice, perhaps into the acute sector, and other areas as and when appropriate.
We have some very clever technologists, some very clever application developers within the organisation, and actually one of our core strengths is that technical background. But without the lead from the clinical team, that technology can become technology for technology's sake, and that's not what the company's about, that's not what our customer base is looking for. It doesn't best serve the clinicians that we target, nor does it serve the public that they serve.
The future for Clinical Solutions and our products is really to utilise our universal framework in all healthcare settings. We certainly see a future whereby you can access our solutions, and for that matter our customers can deploy and express our solutions through IPTV, through the web, using telephony services and any other convergent technology that's around there, whether that's PDAs or any evolving devices.
Basically taking the application to where the clinician needs it to be, rather than having the clinician come to the application.
We've got some excellent customers and customer relationships. some very powerful customer references. And I think we're delivering what few others are, few of our competitors are, which is real clinical value into the NHS. We've got a huge potential, and at the moment an untapped potential.
Clinical solutions, bringing decisions to life.